Good afternoon, everyone. I'm Dr. Sonya Moore, Director of the Anesthesia Program of the Frances Payne Bolton School of Nursing at Case Western Reserve University, and the co-chair of the Marian K. Shaughnessy Nurse Leadership Academy, Doctor of Nursing Practice Founders Circle Lectureship Series. Welcome to the last panel in our series, Nurses Decode the Debates. Thank you for joining us this afternoon as our panel of nationally known nurse thought leaders provide their insights on the presidential debate last night. This afternoon's event is organized by the Marian K. Shaughnessy Nurse Leadership Academy here at Frances Payne Bolton School of Nursing. The nation watched the two presidential candidates discuss issues of importance, and many who watched last night's event thought it was the best debate between the two candidates. Nevertheless, we are here to talk about issues raised last night by the candidates. With just an hour to discuss, we recognize that we won't be able to talk through every item as thoroughly as we may wish. Joining us today are Maureen Flanick, who works as a tenured faculty at Cuyahoga Community College for over 10 years and is a current Doctorate of Nursing Practice student at the Frances Payne Bolton School of Nursing. Dr. Theresa Campo is chair of the Department of EMS and director of the Emergency Nurse Practitioner track at Drexel University. She received her Doctorate of Nursing Practice degree at the Frances Payne Bolton School of Nursing. Dr. Mary Beth Modic works as a clinical nurse specialist and received her Doctorate of Nursing Practice at the Frances Payne Bolton School of Nursing. Susan Stalker works in higher education and received her Master's in Nursing at the Frances Payne Bolton School of Nursing. The panelists will be speaking from their personal and professional experience. Their remarks do not represent any organization. We will start and end with a question posed to all of our panelists. We have 4 topics which our panelists will discuss: healthcare policy, the COVID-19 vaccine, health disparities, and prescription drugs. For each question related to those topics, 2 of our panelists will respond. If time permits, we will address any questions posed by attendees in the Zoom chat feature. Our first question is for all of our panelists. What did the candidates say about healthcare that resonated with you in your role as a member of the nursing profession and as a healthcare professional? Dr. Campo, please start us off.
That we nursing professionals need to come together and educate and advocate for our patients and profession. But seriously, thank you for inviting me to this discussion. With regards to COVID, I felt that there were 2 very different perspectives on how things have been handled. They both stated the same parameters that were needed to control the virus. President Trump discussed medical treatments being developed and tested and used, as well as the vaccine development and distribution. Vice President Biden spoke about wearing masks, rapid testing, opening of schools and businesses, but seemed to have a gloomy approach to things with remarks with regards to President Trump that it was tragic, and also stating that we're in for a dark winter. I just don't feel that that's the approach to getting America to fight COVID. We need to have some perspective that is positive and work together. I didn't really hear a plan from either of them regarding moving forward with emerging hotspots and treatments and how that is going to be handled, as well as it seemed more about blame for what has been done or not done and on the negative side. President Trump stated he would use the military for distribution of the vaccine, but nothing more about his plan moving forward. Again, didn't really hear the nuances of how we're going to move together and forward. What is the plan for education rollout? And a complete shutdown really is not the answer. There's just too many consequences with mental health, addictions, substance use, and suicide. healthcare overall, I felt I feel that it really has always been political, but it is not. Right now, it's being too political, too polarized. We're dealing with people's lives. Politicians should not be making decisions without all stakeholders being involved. Nurses are at the bedside. We're in the forefront of healthcare in the United States and abroad, and should be at the table every time. We need nurses on boards in leadership positions to speak for the patients we care for and continue to be our patient advocates. As nurses, we need to be cohesive in order to affect change in making a better healthcare system in the United States and to be more politically active. Thank you.
Thank you, Dr. Campo. Mary Beth, would you like to go next, please?
Sure, I'd love to. So I'm delighted to be here and thank you for this wonderful opportunity. As I listened to the debate last night, there were just a cacophony of ideas going off in my head. And what I left with from that debate is that nurses are poised to be at the table. Currently, there are only 2 nurses who serve in the US Congress. And I felt compelled to say that we need to be more politically active and assertive and writing our congressmen, writing our senators. I also thought that this was a call to action to every registered nurse in the United States, and that is to be a member of a professional organization and to be, again, politically active, to verbalize their concerns. It saddens me that healthcare has become so politicized. And I also think that nurses, we are the integrators of care. And we also are the translators of care. And so I think that much of what was said, again, depending upon your political preference, was, for me, the voters, United States citizens will decide the election. But this is, I think, for us, a wake-up call as well as an invitation to be fully involved and conversant with all of the issues.
Thank you, Mary Beth. Susan.
Okay, there we go. Thank you. Thank you. I'm also delighted to be a part of this panel tonight, so thank you. If the issue is what resonated with me related to healthcare during the debate last night, I would have to say that it was Vice President Biden's approach to the coronavirus in terms of looking at data and following the science and the recommendations of the scientists. I also think that he portrays himself as a more empathetic person in terms of understanding the needs of others. The one thing that I will say that I was disappointed in terms of their discussion, from a kind of glass half empty viewpoint, is that they did not talk about nurses enough, if at all. Maybe there was a passing comment about the role of nurses in caring for patients during the pandemic, but I would like to see more emphasis placed on the role of the nurse and the importance of the nursing profession in providing healthcare in the country.
Thank you. Maureen.
Hi, thanks. It's wonderful to be here, and thanks for the opportunity. So I know that President Trump may be overly optimistic concerning his goals and timelines with respect to the vaccines and containment of COVID-19. I think he has the best intentions for our citizens, and I do believe Vice President Biden also has well intentions with respect to the virus and the American people. As I've had experience in testing and trials and research for patients, I'm familiar with the significant length of time and it takes for testing and trials and research for patients. I'm familiar that, you know, it takes a while for the approval process of these medications for approval for the general population. And I feel under President Trump's leadership, many companies and institutions and global entities are working together, I guess, as fast track solution for COVID crisis that may be and that's affecting the global populace. With everyone working together in a spirit of harmony, um, let us hope that the goals set by President Trump can be obtained. I really did not hear much about nurses either last night in the debate. I really think that we do need a call for action for nurses to step up and participate in our legislature, and we do need to get politically involved. And that's all that I have.
All right, thank you, Maureen. Our next question is on healthcare policy and is for Theresa and Susan. The Affordable Care Act is a main difference between the two candidates. President Trump proposes to repeal and replace Affordable Care Act and Obamacare, or Obamacare, as some call it, but has not been provided a plan or details. Vice President Biden plans to expand the Affordable Care Act beyond the 20 million people currently covered and to reduce the Medicare age to 60 years old. Please comment on the implications of these positions for healthcare delivery and utilization. Theresa.
Okay. The first thing that struck me with the ACA was statements regarding that 20 million could lose their insurance coverage, and also 180 million could lose their insurance coverage, depending on whether it was repealing ACA or curtailing private insurance companies. And I just have one major question: is that acceptable? Is it acceptable that 1 million, 100,000 people would be without insurance? That doesn't give me an answer, and that's concerning. President Trump wants to repeal and replace the ACA and terminate the mandate and reduce premiums and keep pre-existing condition coverage. And he spoke about developing a new healthcare plan. Where is it? Why now? Why not over the past few years? And what is that plan? Who will develop it? Vice President Biden stated he wanted to keep the ACA and add a public plan, which would make it Biden's care. He also stated reducing premiums and drug prices, and that he does support private insurance. My question to this is how? You can't effectively reduce drug prices without pharmaceutical companies reducing their prices, insurance companies paying for them. What is the cost to accomplish all of this? And will restrictions or mandates be placed on the insurance companies or pharmaceutical companies with the amount that they charge or do not cover? The infrastructure of insurance needs to be worked on. We need to look at the history of insurance, starting where it started with our military and the development of Medicare and Medicaid with Johnson. We have to learn from the past, answer the hard questions before rolling it out on the American people who it will affect. Democrats and Republicans need to come together. We need to realize the healthcare is not political. It's a complex, multifaceted industry. Giving someone coverage doesn't ensure access to healthcare. A person may have insurance, but it doesn't necessarily mean that they are going to get the care that they need because of high premiums, co-pays. In the emergency department, I see it every day where patients come in and they have a $250, $300 copay. And by the time they come in, they're really sick, where this could have been prevented. It could have been treated early on. The pharmaceutical companies and insurance companies and the healthcare industry need to come together, make decisions that are good for the American people. And nursing should be at the forefront of those discussions and plans that affect millions of people. And again, I have to reiterate my colleagues that this is absolutely a call to action for nursing. We have to be at the table.
Great, thank you. Susan.
Yes. I would say in terms of President Trump and his desire to roll back the Affordable Care Act, there's really no apparent plan for what he would replace it with. So that remains a huge question. And in terms of Vice President Biden, I think that there's a lot of confusion about where he really stands, which I think stems from some of the things that were said during the on the debate stage with the others who were seeking the nomination. But the one thing that really kind of struck me last night, it's one of those things that you know, but until you really think about it, in terms of COVID being a pre-existing condition now, and I'm not certain that everyone in the United States thinks of it that way. And so I think one of the critical things in terms of healthcare going forward is that we absolutely have to keep pre-existing conditions. If you really look again and talk about the disparities in healthcare in terms of the higher rates among African Americans and other minorities, the hypertension and diabetes affect those populations more so than others. And so if you don't include pre-existing condition, it just disadvantages those populations even more so. And so pre-existing conditions, but the question, I think in all of this, as Theresa said, is the cost. You know, Biden may have a great plan, but how is it going to get paid for? And he indicated that he's going to tax the wealthy, but we'll see in terms of a real plan.
Okay, thank you. Our next question will focus on the COVID-19 vaccine, and this question is for Maureen, followed by Mary Beth. There was much discussion during the debate about when a vaccine would be available, but the real questions are the distribution of the vaccine, especially related to who should receive it first, and increasing general skepticism about vaccines and scientific evidence as a driver for health policy.
Well, that's really a great question. And again, working for a pharmaceutical research and with top pharma companies on clinical drug trials in phase 3 and 4 on projects, I looked back at research, and on October 13th, 2020, the CDC had been taking directions from the Advisory Committee on Immunization Practice, known as the ACIP, on the COVID-19 vaccines. And the ACIP is a panel of experts from the medical and public health field who actually sets goals and make recommendations for the vaccines for the US, for the public, for the United States public. And as they determine after what the ACIP does is that they determine after the FDA has approved and authorizes the use of the vaccine from clinical trials, and they prioritize if the vaccine is acceptable, and then they'll meet again, and then they'll decide if they need to use that vaccine. So preliminary guidance suggests healthcare personnel would receive the first doses, followed by workers in essential industries, people at high risk for severe COVID-19 diseases due to underlying conditions, medical conditions, and people over 65. So skepticism with regard to vaccines is not only limited to COVID-19, but there has been a pushback regarding several vaccines and their effects on children in recent years. So politics needs to be eliminated, I think, from the debate on COVID-19 vaccines. True science needs to be the only barometer used in determining the safety and effectiveness of any approved vaccine. President Trump mentioned last night that he has this Operation Warp Speed, and it's going to be using various government agencies, including the Department of Defense, to expedite that distribution. And again, you know, I really think that he's real optimistic in getting that vaccine done. And I think he mentioned sometime in early 2021, and I would hope that he's right, but I don't know. He may be not, but you know, optimistically that would be great for us.
Thank you. Mary Beth.
Well, I'm probably the only person on the panel or even listening that had to stand in line in the 1960s to get the polio vaccine in a sugar cube. And there's a very famous picture of Jonas Salk giving the vaccine to his 3 children in their living room. So what I want to say is that trust is an important commodity, and there isn't any. And we can say it's going to be done in December, it's going to be done in January, it's going to be done in March, it'll be done available 2 years from now. And I think that we need to have a step back. And I think that we need to be, again, bringing in the scientists, the head of the CDC, the head of the FDA, and having like moments with scientists as part of the daily news broadcast, and saying that this is where we are in development, because right now there are 2 or 3 studies that are halted because of some poor patient outcomes. That is frightening. When we were looking at distribution, again, they were going back to 1985 and the SARS epidemic. And so again, what we're looking at is people have to trust those that would be administering the vaccine and those that are advocating the vaccine. As nurses, we're the most trusted profession. And I think that, again, all of us, those listening, are saying, your family, your neighbors are saying, would you get the vaccine? Do you trust the vaccine? And I have to keep saying, I don't have the information to offer you an opinion. I'm frightened. And so I think that there has to be as intentional and as pure and as scientific as the approach is to make sure that we have a safe as well as effective vaccine. We also have to deal with the pandemic of fear and the mistrust and distrust of those that are propelling it forward and saying it will be available very soon, that are not dealing with the vaccine or are the scientists leading the research.
All right, thank you. Our next question is regarding health disparities, and this question is for Maureen and Theresa. The debate gave virtually little attention to health disparities in the care of the poor and underserved, especially those who are underrepresented minorities and the elderly, as well as the LGBTQ community. What are the important distinctions and considerations from your perspective, Maureen?
Being that I'm currently studying in the DNP program at Case, and health disparities and social determinants of health are close to my heart, and this is what I'm really passionate about. So it was unfortunate that this debate, to me, did not cover health disparities. It is understandable that the issue was not addressed as overwhelming issue of the day was respect to the health care. Of course, it's COVID-19. So a secondary health issue covered in the debate was the ACA/Obamacare and health insurance covered for all Americans, especially with respect to covering pre-existing conditions. I spent the summer actually working with health disparities in a rural community in Ohio, where many of the patients had no insurance. And directly, these patients, I worked with women's breast health. And so there's a common bond with these, with the healthcare plan that with no insurance. So a lot of these patients had needs and they weren't being met. And especially with these women with breast issues, I was trying to get them in for MAMs and other testing, and they wouldn't come in because they had no health insurance. And I was doing a lot of patient education and encouragement. And they just said, even if I had a lump, there was nothing I would be able to do if I had cancer because I have no insurance. So, what we're saying here is that we really need to do something for all patients. And so I really think that if as nurses we need to be the patient's voice, and if they would come together at the table and bring us in, I think that we can be able to help our patients with some type of coverage. I mean, it's just very sad where we are actually today. there needs to be some type of help for these patients and care. That's all I got.
All right, thank you, Maureen. Theresa?
Oh, I wasn't sure if you wanted me to just jump in. Sorry about that. I too was disappointed that this wasn't discussed much further with President Trump and Vice President Biden. It's such a hot topic, not just with COVID, but with other aspects of healthcare. For instance, looking at COVID and the higher incidence with the African American community and the Latinos, and not even the disparities just in the ethnicity, but the differences in blood typing and other things that are genetic and different for each of us. And I think that this is something that really needs to be focused on instead of the industries. I kind of, when I was listening to them, the question was about disparities, was about, individuals who either can't afford to get insurance, but also live in areas that are heavily polluted, and what are the regulations or restrictions that are happening with that. And that became the focus of the regulations of the companies and not the people, which was the original question. I just don't feel that they get the point that everyone has a right to be healthy regardless of where they live, regardless of socioeconomic levels, their age, the very young, the very old, as well as sexual orientation and gender identity. There should be impartiality for everyone and a reduction in judgments and biases across the board. There are lots of differences in how patients are treated based on socioeconomic and ethnicity and gender preference or gender identity, and that shouldn't even be part of what we do in healthcare. It shouldn't even be a factor, and we need to really dive in and see how we can screen patients who have potential barriers to access to healthcare and find out how we can get that for them. We also need to remember that all of us are genetically different. We have different responses to illness, to medications, to treatments, and we need to first focus on these differences and how we can individualize care and promote those positive outcomes. And we all have a right to be treated with respect. It's imperative for all of us healthcare professionals to be educated ourselves on genomics, on equality, on healthcare disparities. And I think government officials should also be included in that education, because it really was just mulled over last night.
Thank you very much. Mm-hmm. Our next question is concerning prescription drugs for Mary, Beth, and Susan. Prescription drug prices were briefly discussed last night. President Trump plans to drive down prescription drug prices by allowing imports from other countries. Vice President Biden plans to repeal the exception allowing drug companies to avoid negotiating with Medicare over drug prices. What are the issues around helping Americans have access to affordable prescription drugs? Mary Beth.
Well, the famed U.S. Surgeon General Everett Koop said in 1985, medicines don't work for patients who don't take them. And so we certainly have a healthcare system in which, prescriptions are generated and distributed, thousands on a daily basis. But the sad thing is that they are cost prohibitive for thousands, millions of Americans. I think that we have an example, certainly with the VA system, and that they negotiated with pharma, and they pay half or a third to what other agencies pay. I think when we listen to these conversations, again, each one of us can tell stories. As a clinical nurse specialist in diabetes care and as a certified diabetes care and education specialist, the cost of insulin is making it impossible for many to follow the medical regimen. And so when you think about in 2009, rapid acting insulin was $93 a vial. It's $275 a vial for the same medication. So I think that we can't just send people up to Canada to be getting medications. I think there again has to be very strategic negotiations, realizing that pharmaceuticals need to make money to, again, research and development to manage those costs. But I think that, again, we do need governmental advocacy in making these drugs affordable. Related to that, then, if you are being able to take your medication for your high blood pressure, take your medication for your asthma, we would have patients that would be healthier. We are confined by all of the restrictions. And I may, if I will indulge me, to talk about health disparities. And NPR about 5 years ago did this most remarkable program on zip code as the 5th vital sign. And so where people live can define their life expectancy. And so for those that are living next to chemical plants, or those that are living in high pollution areas, or those that are living in, again, very underserved areas, their life expectancy is 10 years less than other individuals. And so I think as we spend this hour looking at all of these dilemmas just related to healthcare and what's impacting us, I think that it calls for all. We have brilliant men and women. We have our next door neighbors that say, you know, why does this cost so much? Or why does when I go to the doctor, I never know how much it costs? Or why can't I have a van in my neighborhood that provides normal screening? And we do have those. We have those all over the United States, but we don't often, again, discuss these models that are very, very high quality, accessible, and reasonable cost. It's like, I think about these debates, and if I may again say that it's like we're trying to cram all of this information. It's like we have a gallon pitcher or a quart pitcher, and we're dumping a gallon of water. And so we can only manage as many things as possible. I do think that the pandemic, our response to the pandemic has accelerated and identified, as we all know, the terrible inequities in healthcare. And in rural America, people that are not having the access that those of us, for me in Cleveland, I have we all have three, those of you in Cleveland have 3 large facilities that we could go and get incredible state-of-the-art treatment. And we would get medications that are very, very expensive. Unfortunately, we have insurance that would be minimal. So the idea is, I think we do need more specifics. I think we need to, again, agitate and lobby for things that are reasonable. And I think reasonable drug costs would have far-reaching implications in terms of the health of our nation.
Thank you. Susan.
I think that we're seeing a common theme in all of these topics in terms of the health disparities and the impact that some of these issues are having on the disparities and the inequities. I live in Ashtabula County, which is in Ohio, which is the largest county in the state of Ohio, geographically speaking. It takes about 45 minutes to get from the southern part of the county to the other part of the county, the northern part of the county where the city is. And it's rural, and many folks don't have cars. They don't have money for transportation to put gas in the cars if they have a car. And before I started working in higher education, I was a home health nurse. And we all know as nurses that even though the physician or the nurse practitioner may hand you a prescription, if a mother has to choose between buying food for her children and getting her prescription filled, she's going to buy food for her children. And until we resolve this issue, we're just going to continue to see uh, people who could be healthier and could drive down the cost of healthcare if they were able to afford their prescriptions. And we also know as nurses that it's not just about the cost. I mean, it starts with the cost, but as nurses, we know that unless people understand why they're prescribed that medication, the side effects of the medication, the importance of taking the medication, getting refills, things like that, the importance of finishing antibiotics, things like that, they're uh, the people that we're caring for may not be as compliant. And so while it is about the cost, it's just so far reaching, and it's unfortunate that they did not spend as much time about it. It's got to be a priority for whoever becomes the president. And again, nurses need to be at the table to help solve the issue. And both of the candidates seem to be somewhat in favor of importing drugs from other countries, and that just does not sit right with me in terms of why, aren't we producing those drugs um, in a more cost-effective way in the United States? And I talked to a pharmacist this afternoon and said he would have real concerns about the quality of the drugs that are produced in other countries. And so that's another issue in terms of importing prescription drugs. So it's an issue that I think, needs to be a priority, especially with our aging population.
Thank you very much. This question is for all of our panelists. What are the important issues that you would like to have the candidates discuss? Let's start with Theresa.
Thank you. I'd like to hear what the actual plans are of the candidates with regards to healthcare, not just that they're going to drive down prices, that they're going to drive down premiums. How are they going to do it? What are the steps? How are they going to roll it out? What is the impact on all of us? Because any adjustment you make in healthcare, whether it be insurance coverage, whether it be the prescription medication cost, that trickles down to each and every one of us. As Suzanne very nicely said, if I have a choice between feeding my family or getting my medications, I'm going to feed my family. I'm going to do what's right for my family. So the effects short term as well as long term. And how is the healthcare plan going to grow with the country as well? I'd also like to hear about bringing nursing to the forefront of healthcare discussions. Until the pandemic hit, we were, considered to be subservient to physicians, that we weren't independent thinkers, that yes, we were at the bedside, but, we just do the mundane things. And with the pandemic, it really brought out how important each and every one of us are, how flexible we are, how diverse we are. And that really needs to come out. I'd like to hear their opinion of that. I'd like to hear them acknowledge the hard work that nursing does and how educated we are and how we care for the whole person. And we do incorporate equality and inclusion. We include the family. We include, looking at what is the problem that really has occurred with this illness and how can we fix it. So I really would like to hear more about how nurses are going to be involved. We're the ones at the bedside caring for the patients 24/7. We need to be at the table. And, I do have to say again that this is an absolute cry that we need to, as nursing professionals, we need to be at the table. We need to be discussing this. And we also need to make the candidates aware of what's important for the health of the United States.
Great, thank you. Maureen.
I guess the big thing here is I think we need to bring the country back together. I think there's been such a division in where we are, and I think I feel I just see it, and I think that not only I know that we are in this pandemic, and and there's a lot going on in our country, and this pandemic is just part of it. And we have to embrace each other, and there's a lot of stress going on, and the stress makes people ugly. And I think that if we start addressing the root of our problems, and embrace each other for who we are, and start looking at the science of this disease, of COVID, and taking the experts' opinions and not being political, I think that would help where we're going, to end. I think that this COVID's going to be around a long time. I don't think it's going to be going anywhere, and I think nurses need to step up to the plate. I think we do have a lot of questions. I think that nurses are doing a lot of, I mean, we're stepping up to the plate. We are leaders, and we're working endless hours. I mean, they're they're tired. They're working long shifts. I mean, they've seen a lot. They're working at the bedside. These patients are dying, and we're the only one there for them. And it's just there's two situations at hand here, and I think that if we start opening up the country, I think the stress will reduce. I think, and I know that's probably you're saying, well, we need a vaccine, or I think that we have to take care of ourselves, and I think we need to educate the public. I think that those of us who need to stay home, and we have to say this is the science. Take care of the immunocompromised, the elderly. Wear your masks when you need to. Um, get out and start opening up the country, take care of our population that's vulnerable. Um, I just think it's just going to be what we need to do. I would really wish that they address the economy, and I think we're just going. It's going to peak. It's going to get worse before it gets better. I hope I made some sense there. I don't know. That's all I
Okay.
got.
All right. Thank you.
Mhm.
Susan.
I'll take a little bit different approach to this, and I know we're talking about the presidential debate from last night, but one of the things that I've become much more aware of this past 6 months or so is of also following the down ballot races, as it may be almost as important who gets elected to Congress as it does to the presidency, because we can see what's occurring now in terms of the seating someone in the Supreme Court. And so I think everybody needs to pay attention to what those who are running for president are saying, but also to pay attention to who's running for Senate and their stance on things, as well as the U.S. House of Representatives, because it can make a major difference.
Okay, thank you. Mary Beth.
So I would just tag on to what Susan said, and that is not only look down the ballot about your representatives, but your judges as well. I think that, as I've gotten older and really appreciated the value of my vote, I also have spent a lot of time in preparation to think about why would this candidate be good, or because I certainly think we look at congressmen and our state representatives, but the judges are the judiciary branch of our government, and the potential survival of the Affordable Care Act will rest with the Supreme Court, possibly. So just that, I think, was an important concept, and Susan, thank you for bringing that up. I also want to say that I think in terms of healthcare, in terms of all the issues that the candidates are trying to espouse and to win over, or to present a snippet of their policy, these problems did not occur overnight, and I think we have to look at an evolution. And so Before we had the Affordable Care Act, we had millions of people who did not have access to health care. It has been a lifeline for our neighbors, for our patients. And I think that to disband it would be unwise. Are there certain shortcomings of it? Absolutely, absolutely. And I think that we need to build upon what we have. I think when you take a sledgehammer to a stained glass window, you end up with shard glass and nothing. And so I think what I would like from the candidates is to say, I am not going to be able to do this on day one and sign an executive order. I am not going to be able to do this in the first month and everybody's going to be great. I think we need to say that this is going to take 6 months at a minimum to bring together and have thoughtful dialogue. I also think that the American people are hurting. We all can account or describe someone who we know who has had COVID, or sadly someone who has died from COVID. We also can attest to patients who, as Maureen was talking about, were reluctant to seek out healthcare given the pandemic, and so they did not, and now are dealing with the consequences of an illness that is unmanageable at this point. So I think but I think we have to say that everything's not going to be fixed, and we as a country have to be patient. I think the final thing is, as for nurses, I think again we have all articulated where we think we belong, and how do we make that possible. And so again, writing our legislators, immersing ourselves in the literature, becoming involved with, again, as I mentioned, our professional organizations, and writing them and saying, I don't see a policy on our organizations on clean water. I don't see a policy on gun violence. I don't see a policy, etc. And I think that we will, it is important to be patient, but it is also important to be informed. It is also important for us to become politically active as well as astute.
All right, thank you. That's all of our formed questions, but we do have a question from the audience. And Maureen, hopefully you'll be willing to take this for us. There are differing opinions on the necessity and intensity of lockdowns needed to slow the spread of COVID-19. Irrespective of the candidate's view of lockdowns, lockdowns do in fact have consequences that affect the health and well-being of people. Mental illness, undiagnosed illness, deaths from suicides, drug overdoses, depression, malnutrition from hunger, school lunches, etc. How would the candidates balance the need for reducing the spread of COVID-19 while at the same time mitigate the indirect detrimental effects of lockdowns on people?
Okay, so it appears that President Trump was more concerned about the negative consequences than Vice President Biden. And Biden seemed more focused on masks and lockdowns and direct effects on COVID-19. I think Trump wanted schools open, people working, and businesses open, so to get back to normal as soon as possible. Biden stated that wearing masks and reducing class sizes may work to get kids back to school. The question is, can businesses survive? That is, to be profitable at least 50% efficiency. So Biden said that the federal government would have money to pay their businesses and extra school expenses. With the national debt over $27 trillion now, and severe reduction in taxes paid to the government as a result, I guess, as the devastation of the economy from COVID lockdowns, I guess where's the money going to come from? It seems to me like a catch-22 situation.
Thank you. I
Mhm.
agree with that. Does anybody else want to tackle that question?
I'll take that on.
Okay.
Thank you. So, in the emergency department, we're seeing this firsthand. I will tell you that I have professionally never seen the numbers of suicide attempts, the depression, the anxiety that's coming through the door, the substance abuse, the overdoses. For me to leave the emergency department at 3, 4 o'clock in the morning with 16 to 18 patients just in that group, that's significant. That's significant. And it's not happening once or twice. It's happening on a more routine basis. So we do need to think about the consequences of the pandemic in and of itself, but also the consequences of the lockdowns. I think that we need to take a stepwise approach and see and evaluate what is happening at the local level and not just grouping everything together. It is not the same. Here in New Jersey, it's very different from South Jersey to outside the Philadelphia area to North Jersey, completely different areas, as well as other places in the country. And we need to devote the resources to help to treat the patients in the outpatient setting as well. And I'll tell you one thing that has occurred, and it has made a significant difference, is one of our local hospitals received grant money to be available 24/7 via telehealth as well as mobile units to go out into the community. And, you know, if we can't get a person into rehab or detox or, you know, be able to give them the resources from the emergency department and know that it's going to be a safe plan, we can connect them with CARES and we can connect them with this hospital so that we know that the next morning they are going to be connected. They are going to have treatment that is going to be put in place and initiated in the emergency department and will continue in that outpatient setting until they can get the definitive treatment and resources. So I think we really need to look at some innovative ways of providing that care. As nurses, I think we have a lot to offer, and I think we need to tap into our public health colleagues to help us to make those connections and get the resources where they need to go.
Thank you.
Mm-hmm.
Well, that's it for our questions. And so I want to thank you for joining us tonight in our last Nurses Decode the Debates panel. I want to thank our panelists for their thoughtful reflection and analysis of the topics mentioned in last night's presidential debate. I want to thank all of you who joined us tonight. It is the year of the nurse, and every year it is so important that our nursing voices and nurse leaders continue to engage in conversations that shape our healthcare and the health of our nation and the world. If you are looking for a way to help energize the vote, is looking for volunteers and support. This local group will be at voting locations on election day and on Saturday, October 31st, to support individuals having to stand in long lines. Donations will be accepted to help provide water and snacks for those individuals. Call the number listed or reach out to me. Thank you again and have a fantastic evening.